think I'd like to put myself forward for the sister tutor position at St. Cuthbert's.
I thought you might.
You did?
Not only are you a clinically excellent midwife, Sheila, but you've always been as fascinated by the science as I am. Makes you a natural teacher.
I'm rather rusty, though. It's been a while since I used my teaching skills.
And it'll be a good chance to get back in the saddle.
Oh, fabulous.
Can you help me, please?
Good Lord, you look like a wreck of a Hesperus. We evidently drive. Oh, for the simple reason that my car is currently at the garage.
Miss Higgins, you're very late. You've not forgotten I'll be at the hospital today.
No, I have not.
Nurse Crane says you spoke to her about adding a patient to the district nursing round, but I've looked and I can find nothing about it.
Well, then, if you don't mind my saying, you can't have looked terribly hard. Oh, here we are. Louise Ricky, admitted to St. Cuthbert's for a suspected kidney infection, discharged early due to their current lack of beds.
Wonderful. Thank you, Miss Higgins.
You're most welcome, Mrs. Turner.
Mrs. Williams, we're ready for your glucose tolerance test.
Oh, but I thought I was supposed to drink something.
Blood test first, then glucose drink, then 3 more tests.
Oh.
All right. Come in, sister. Thank you.
You were discharged from St. Cuthbert's yesterday, is that right? And how have you been feeling since then?
Not too good, to be honest, sister. Pain in my side's been getting worse. And this morning, when I went to spend a penny, it looked like there was blood.
In your urine? Oh, well, that doesn't sound too good. The hospital tested for a urinary tract infection, but it came back negative.
That's what they said. And they just sent me home. Well, first things first, I'll take a urine sample. Then, if needs be, I can ask the doctor to call in on his rounds. How does that sound? Thank you, sister.
Right.
Pupil midwives, I'm Sister Turner, and I shall be supervising your work today. Thank you for being on time. I consider punctuality to be the sign of a well-organized mind.
Yes, sister.
Shall we go on to the ward?
I'm sorry, sister. Mr. Armitage hasn't finished his rounds yet.
He's always late.
But don't worry, he never stays very long.
Good morning, ladies.
So, you've mainly been feeling the pain on the left side.
And in my back.
Have you had any other symptoms?
I've been feeling dizzy. And sometimes it feels like my heart's going really fast. And the sister said there was blood in my urine sample.
Your heart rate seems to be normal at the moment.
Do you think I might need to go back to the hospital?
I think that would be necessary right now, but I would like to take some blood while I'm here. Then, I'll run some tests. Do you live alone, Miss Ricky? And are you in work at present?
I was let go.
Oh, I'm sorry to hear that.
Mrs. Williams, were you here to see the consultant?
I was. Yes, Mrs. Turner.
Is everything all right?
3 hours. I waited to be spoken to like that. I won't be coming here again.
Mr. Armitage, I believe you've just seen one of my patients, Mrs. Williams. She was referred for a glucose tolerance test.
Yes, well, no surprises there. Third trimester, severely obese. I told her she just needs to eat less.
Only a colleague of mine was reading a recent study on latent diabetes in pregnancy.
I am aware of the study, and I would caution your colleague in the strongest terms against confusing her patients with
worrying over it, are you?
The consultant was so rude, Patrick. I just keep thinking, if that's how he spoke to me, imagine how he made poor Patricia Williams feel.
Still, Mrs. Williams won't be helped by you losing sleep.
Lucille, my sincere apologies, but I fear Sister Frances' visit to the dentist has become a matter of urgency. Might I prevail upon you to forego your afternoon off and take over her rounds?
Of course. Vad är ni planerar att göra med Angie?
Thank you.
So, you've got 2 different types of sandwiches, and a bit of pork pie, and I made you a few angel cakes, so mind you don't squash them.
You really didn't have to go to so much trouble.
Nonsense, it's my pleasure. So, how are you planning on getting there?
I borrowed a car from the garage for the afternoon. Thought we should travel in style.
There you go. Up easy. Scrapped up all right, didn't it?
It's perfect.
Good morning, Dr. Turner's surgery.
It's Louise Ridley. I'll need the doctor to come and see me.
I'm afraid Dr. Turner has already begun his rounds. If you can tell me what the problem is?
He came to see me before. I'm still in pain.
Then might I suggest you come into the surgery? I can offer you an appointment this afternoon at...
There's something wrong with it, woman, isn't there? Psychological.
Lenatus House, midwife speaking. I see. All right, not to worry, Mr. Williams. A midwife will be with you presently. Patricia Williams. It seems her contractions started during the night, but she didn't want to bother us till she was sure baby was coming.
Until she was sure it would be too late to send her to the hospital.
Lucille.
Oh, sorry, Cyril. Can't stop. Me have a lady in labor.
I wanted to surprise you. I thought it was your afternoon off. I borrowed a car.
Oh, I'm so sorry. Sister Frances had to go to the dentist, so we swapped. I have tomorrow instead.
5 years old, 98% of everyone is a creative genius.
But where does it go?
In terms of creativity and innovation, we don't nurture it well.
So how do we unlock our kids' creative genius? That's Sunday this week on One.
While on your Getwise journey, keep an eye out for opportunities to earn money and stay cash clever.
Cool robot. I give you $10 for it.
I tried to fix it, but you can have it.
Really? Thanks, man.
No worries.
See ya. Check this out. Vintage robot. Only $15.
ASB Getwise, helping Kiwi kids get one step ahead.
+9.
Maybe I can go ways.
Oh, by the way, Ron had a look at the vacuum cleaner and he reckoned there was nothing wrong with it. It was just it was dirty. Like, I cleaned that filter, but there was quite a bit of dust stuck somewhere, funny, and he cleaned it all out, and it was fine. The vacuum was pulling well.
Well, that's good, I guess.
I'd like an electric car, but they're pretty expensive.
Oh, you know, Mrs. Williams.
Getting there, I think.
They come here every few minutes now.
It's a shame you didn't call us sooner. But never mind. Let's get you upstairs, shall we?
Did you call Jasmine?
I did. I have a shift at the hospital, but her sister will be here for the children.
Tell her there's a plate of cold beef, and she can give them 10 peaches.
All right. Let's not worry about the catering. You have more important things to think about.
Well, don't just stand there. Go to work.
Miss Ripley. I'm sorry, sister, but my side is really hurting. And I called the surgery, but they wouldn't let me see the doctor.
Goodness, you better come inside.
No, of course, Miss Higgins. Clearly there's been a misunderstanding. I don't think we will require an ambulance. I shall take it from here. I think we should get you home.
That's it, Mrs. Williams. Breathe nice and deep. There you go.
I don't remember it hurting this much the last time.
Me know, precious. And as soon as this one arrives, you'll forget all over again.
I'm just sorry you went to all that trouble for nothing.
Oh, what a shame. But not to worry, the cakes will keep, and you can have the sandwiches for your tea.
No, really. You should have them. But thank you again.
Well, I'll at least get a plate.
It's a picnic.
Have you eaten anything today? I'm not surprised you're feeling dizzy. I wasn't well enough to get to the shops. Have you any family nearby? Anyone who can pop in with a few bits? My sister's in Kent and my mum, well, she's on her own and she's not too well herself. Perhaps a neighbour then? I don't know them. I was in Dartford before. I had a position as a hospital clerk. But then I was let go and I had to move.
That's it. Bear down for me, Mrs. Williams. Keep going. Keep going.
You're doing so well, Pat.
Then why isn't he coming?
We have quite a tight curve to negotiate on the way out, so we're going to try and change position again.
I've been pushing for so long. I can't do anymore.
I know it's hard, and I can see you getting tired, precious.
This isn't right. I told you. This doesn't feel like the last time.
Jasmine, will you run down and call the surgery? Say Nurse Anderson would like Dr. Turner's assistance and ask him to come as soon as he can.
This is ever so kind of you. There's money in my purse for the bread.
Oh, just mind you don't skip any more meals. Oh, goodness. I really must be getting on.
Of course. Thank you, sister.
Oh, what's the matter?
Oh, it's my leg. I
it's like a spasm in my thigh.
It's all right. It's probably just a cramp. It can be terribly painful.
I'm sorry, you need to go.
I'm afraid I do. But I'll mop up that tea before I leave you.
Sister Monica Jones, it's time for Coldplay. Sister?
All right, Mrs. Williams. The local anesthetic should be working now.
This isn't what I wanted.
Just stay nice and calm.
No.
The head's still too high. We shouldn't delay any further. If you could call for an ambulance, please.
What is it? Where's she going?
I'm afraid your baby's not comfortable, Mrs. Williams. We're going to need to deliver by cesarean section.
No,
Steady
please,
now.
no.
Steady. Don't be alarmed. Nurse Anderson will accompany you to the hospital.
Nurse, what's happening? Is she all right?
The wife needs a cesarean section, so they're taking her into theatre.
She wanted to have the baby at home.
You know what, Mr. Williams? But sometimes we don't get to decide.
What can you say, Alan?
Will the Black Lady die? She might die. I think I need to go loose. Oh dear. Oh dear.